Okay, so it's 2020 and we once again have a Democratic candidate, Joe Biden, supporting a healthcare plan with a public option. There seems to be a lot of cynicism over whether it will pass, assuming Joe Biden wins. So let's take a look at what happened in 2009, and how the public option got dropped. In the 2008 presidential election, Barack Obama campaigned on a healthcare plan that included a public option. He was inaugurated in 2009, and later that year, a healthcare bill that included a public option actually passed through the House. The Democrats got it through, despite GOP opposition, because of their sheer numbers. Where it failed was in the Senate. Joseph Lieberman, a quote-unquote independent who generally caucused with Democrats, threatened to filibuster the bill. The Democrats needed Lieberman's vote to make for a supermajority. So, if the Senate had included a couple of more Democrats, or if Lieberman didn't suddenly do a 180 and go full Senator Palpatine.
I am the Senate. No. No, no, you must die!
A public option would almost certainly have passed that year. Keep this in mind when you hear clever sound bites like this.
It is. And by the way, we would have had Romney care whether Barack Obama was elected or not, because the insurance companies and the pharmaceutical companies wanted it. That's why we got Obamacare. That's why. And we didn't get a public option because his donors didn't want it. So, again, everything points to a big failure, Barack Obama. He had no...
False. No GOP president would have signed Obamacare into law. This should be obvious given the fact that the GOP resisted Obamacare, and that Trump and the rest of the GOP have been destroying Obamacare over the last few years. Jimmy Dore is calling it Romneycare due to its similarity to the bill that Mitt Romney passed as governor of Massachusetts. What Dore is leaving out or doesn't know is that regionally, Northeastern Republicans are quite reasonable. However, their policies won't pass GOP muster on a national level, which is why, when campaigning, smart people like Mitt Romney have to sound as close to loony as Ted Cruz as possible. For example, as governor, Mitt Romney was on record supporting indexing minimum wage to rise with inflation.
I know in New Hampshire that they've worked to scale back minimum wage, and I haven't heard you talk about minimum wage on the trail. I was wondering what your position is.
My view has been to allow the minimum wage to rise with the CPI or with another index so that it adjusts automatically over time.
So you'd support that as president?
I've already indicated that when I was governor of Massachusetts, and that was my view. Thank you.
Can you imagine any GOP president pushing this? Obviously not. To reiterate, the House Democrats passed a healthcare bill with a public option, despite opposition from GOP House members. Virtually, if not literally every Senate Democrat supported the bill with a public option. 0 Senate Republicans supported the public plan. Keep that in mind when you hear the arguments of false equivalency. You may have heard about the Democrats having a supermajority in the Senate. That's not true unless you count the 2 independents who generally caucused with Democrats, one of which was Joe Lieberman. And even that supermajority only lasted a few months. It began when Al Franken was finally sworn in on July 7, 2009, 246 days after his contentious election, and ended on January 19, 2010, when Scott Brown would defeat Martha Coakley to fill the vacancy left by Ted Kennedy's passing. From this point on, the Democrats would have 57 seats, and we would eventually get the Obamacare that we got. Certain concessions were made to get enough votes to pass something. The bill was hardly perfect and full of problems, but it did expand coverage to millions of Americans. Of course, Republicans have all but killed the bill, and it's dying a death of 1,000 cuts. Whatever you do, don't fall for the false equivalency. One party really is trying to expand coverage, the other side is trying to privatize as much as possible and if given the chance, will bring us back to a Gilded Age-like society.